5 Natural Ways to Overcome Erectile Dysfunction. Hello. I'm Professor Rahim. And this is my second video on erectile dysfunction. What is erectile dysfunction? Erectile dysfunction, also referred to as ED, is the condition in which a person finds it difficult to keep an erection long enough for sexual intercourse with their partner. This is sometimes called impotence, although that term became outdated as more people began to suffer from certain health conditions that made getting an erection not just hard, but impossible. In my last video, I listed the common causes of erectile dysfunction. In this video, I would be going through 5 natural ways to overcome erectile dysfunction. But first, how common is ED? You must know that erectile dysfunction is very common. Is the condition treatable? Yes, treatable by a medical professional. Does diagnosis require lab test or imaging? Yes, it often requires lab test or imaging. Is time taken for recovery? Yes, recovery can last several months or years. Condition highlight. Common for males ages 60 and older. What are the possible symptoms of ED? Maintaining erection at times may be common, but during erectile dysfunction the symptoms are persistent and includes trouble getting and maintaining erection, reduced sexual activity or desire, physical examination of the penis and testicles, and medical history helps the doctor diagnose erectile dysfunction in most cases. The common tests procedures taken includes hormone test to measure the levels of male hormones, urine test to check for diabetes or any infections, digital rectal examination to check for changes in prostate gland, ultrasound to get images of the penis, psychological examination to assess for psychological disorders, nocturnal penile tumescence to assess the quality of erections during sleep, complete blood count to check for heart disease, diabetes or infection causing the symptom. The choice of treatment is based on the underlying cause, and includes medications, therapies such as self-injections and exercises, and surgical implants. Like I mentioned earlier in this video, we would be going through 5 natural treatments for ED. ED medications are a common solution for men with this condition, but there are downsides to consider. They can have possible side effects. An over-reliance on ED medication is not uncommon. But pills don't have to be your first or only choice, right? In many cases, lifestyle changes may slow the progress of ED, help manage it, and even reverse it, so you may not need ED medications or have to rely on them as much. Also, it's advisable to look for signs. It's very important to keep track of your sexual function. Do you get an erection often? Is it hard to get erections at all during a certain time, for instance? Do your erections take longer than before, or is there inconsistency in their quality and firmness lately? It's important to consult a doctor if you develop any sudden or unexpected symptoms. Your doctor could not only confirm that you have erectile dysfunction but also check for other potential underlying medical issues that may be causing your ED. Now let's take a look at 5 ways to overcome ED naturally. Number 1. Do more exercise. One way to improve your health is to exercise regularly. You may prefer to visit a gym or go running outdoors, but there are also many other ways to reach your fitness goals. If you don't want to venture outside, try an indoor cycling class. Or even do things such as yoga and swim in place using underwater treadmills or virtual reality technology. According to one Harvard study, just 30 minutes of walking each day reduced risk for ED by 41%. In addition, other research suggests that moderate-intensity aerobic exercise can help restore sexual performance in obese middle-aged men with ED. Number 2. Eat right. Several studies have shown that the health benefits of consuming a Mediterranean-style diet extend to erectile dysfunction. The general idea is to eat more natural foods like fruits, vegetables, whole grains, and fish, with fewer red meats and refined grains. As a result, you are less likely to suffer from erectile dysfunction. Number 3. Monitor your vascular health. Elevated blood pressure, blood sugar, and cholesterol levels increase the risk of damage to your cardiovascular system and can lead to a stroke or even erectile dysfunction. Make sure to see your doctor for a wellness exam so you can determine whether you need to make changes in your lifestyle or if it's necessary for you to be prescribed medication. Number 4. Watch your waistline. Men with an approximately 42-inch waist are 50% more likely to have ED than men with a 32-inch waist. Losing weight can help reduce the occurrence or severity of ED, which is why maintaining a healthy weight is one good strategy for avoiding or fixing ED. If you happen to be overweight, reducing your weight by approximately 5% to 10% has been shown to improve sexual function. Obesity raises risks for vascular disease and diabetes, two major causes of ED. And excess fat interferes with several hormones that may be part of the problem as well. Number 5. Work your pelvic floor muscles. Performing Kegel exercises strengthen pelvic floor muscles, and some research suggests they can help with ED. You perform Kegels by tightening the pelvic muscles, which you would use to control urinating or holding in gas. A typical routine of Kegels consists of repeating 10 to 100 contractions within a certain amount of time during your day. If you like this video, don't forget to hit the like button and the subscribe button too. Thank you.